Hey guys, I'm so excited to announce that I've partnered up with Bill and Melinda Gates to raise awareness surrounding this year's annual letter. The annual letter offers perspective on key societal issues and ways that we as a global community can come together to battle these issues. This year's annual letter focuses on the COVID-19 pandemic, as well as preparedness for future pandemics, because whether we like it or not, they are coming. But one of the most important key areas of this letter is that we need to prepare in an equitable way so that no individual, no group is left at an unfair disadvantage. I, as a family medicine provider, have seen these disadvantages play out, and I want to focus on three key issues that I've seen raised throughout the COVID-19 pandemic that I think go hand in hand with Bill and Melinda's thoughts in their annual letter. The first issue I'd like to raise is with telemedicine. And while it's been an absolute central component of delivering medical care throughout this pandemic, it has shortcomings. In fact, it's not a one-to-one replacement for a true in-person medical consultation. The reason for this should be quite obvious: the lack of a thorough physical exam. Without it, we can miss a key diagnosis. And on top of that, there's the lack of a human connection. In order to practice good medicine, you need to be able to adapt to the patient, pick up subtle body cues, truly understand what they're going through, and not being in a room with them presents a major challenge. And for some of my patients who aren't able to afford a nice computer, a nice webcam to have a sharp image in the way that you see me now, they're left at a greater disadvantage relying on only voice communication, where I can't even see them. Look, moving forward, we just have to understand that telemedicine certainly has utilities in the future, but it absolutely also has shortcomings that we need to address. Second, and perhaps most importantly, is that inequality in America is rampant, especially in the field of healthcare. And for myself as a primary care physician, I've seen these harsh realities play out time and time again, specifically in that the quality of your care, your access to treatment, even the length of your life is oftentimes dictated by the color of your skin, your economic status, or even your zip code. Folks, this is a huge problem, and the COVID-19 pandemic has only made this problem worse. So much so that if you're a person of color or of low socioeconomic status, you're more likely to get sick with, spread, or even die of this virus. We need to make sweeping societal changes, and quickly, so that we all have a fair shot at quality healthcare access, no matter the color of your skin, no matter your economic status, no matter any other factor. Third is that we need to prepare for the pandemic of tomorrow, today. In fact, I've seen the horrors firsthand right here in New York City when we became the biggest COVID-19 hotspot on earth, and hospitals were quickly overrun and PPE supplies were dwindling. So much so that many of my healthcare worker friends were left without adequate protection. I went as far as donating funds and securing N95 masks to help keep them safe. But we really shouldn't rely on individual charity, because whether it's in 10 or 100 years, a new disease is inevitably going to come along, and we're going to need deep reserves of PPE in order to keep these vulnerable healthcare workers safe. I'd really love for you to read Bill and Melinda Gates' annual letter, so head on over to gatesletter.com to do so. I'm also curious how you think we can turn the hard lessons we've learned throughout this pandemic into a healthier, more equal future for all. As always, stay happy and healthy.